Icon Alex Trebek reveals shocking details about his health. The Jeopardy host is battling stage 4 pancreatic cancer.
I'm going to fight this, and I'm going to keep working, and with the love and support of my family and friends, and with the help of your prayers also, I plan to beat the low survival rate statistics for this disease. Truth told, I have to, because under the terms of my contract, I have to host Jeopardy for 3 more years. So help me.
Pancreatic cancer has the highest mortality rate of the major cancers, with 91% of patients dying within 5 years of a diagnosis. Dr. Lary Burchett joins us live in studio. Let's talk pancreatic cancer, because honestly, I don't think enough people do at home. When it comes to a case like Alex Trebek, you have an individual who's 78 years old, stage 4. Your thoughts?
You know, cancer can be divided up in the stages. Stage 1, it's right where the pancreas is and hasn't spread. But stage 4 means that the cancer has spread to other organs, meaning the liver and the lungs. With pancreatic cancer, surgery can cure it if you catch it early enough. So if it were stage 1, he could have surgery. We could call that a cure. Stage 4 pancreatic cancer is not curable. It is treatable, so he can still get chemotherapy, radiation, which he's referring to. Maybe surgery could help. But this really isn't a curable cancer.
What about the location of the pancreas and how that plays a role? So it's behind the stomach, right?
It's behind the stomach. The problem with the pancreas, compared to breast cancer, you can do a self-exam, men or women, on their breasts on a daily, and if you have a lump, you can detect it, take it to your doctor, get that evaluated. You can't touch your pancreas. It's behind your stomach, it's back. So unfortunately, many of these cases, when they come in, they're causing other problems because a tumor has gotten big enough that we notice it. Kind of hides behind the stomach, and that presents that problem.
So as I mentioned, Trebek is 78 years old. My father died of pancreatic cancer, and he was in his early 40s.
Sorry to hear
and it
that.
did not take long for him to pass away at the time. So this because when you hit 40,
so
people
young.
say, so why is that, you know? And you would think, why someone in his early 40s, because here you have someone in his 70s, and I know cancer strikes everyone of all ages, but why all of a sudden at age 40 do doctors tend to say, people got to be on the lookout for this pancreatic cancer?
Yeah, well, some of the questions I would have for, your father, did he smoke? What kind of risk factors did he have? Is there something genetic? I want to say 15 up to 20% may have a genetic component. It's probably important for you to talk to your doctor about, do you recommend screenings? Do we want to do an ultrasound or an MRI at some point to look at that? Would you just follow tumor markers like CA 19-9?
So when you talk about prevention, are there, I've been to the doctor, you talk about testing my son, I think we did a couple blood tests.
Yeah.
I don't think it's a 100%, hey, you're clear.
No, it's not.
So there really isn't anything per se for pancreatic cancer when it comes to prevention.
Pancreatic cancer is really difficult to, exactly what you're saying, catch early and prevent. And this is exactly where we're at right now, why you have, unfortunately, people that present so late.
So this is something that caught my eye. I was reading about, out of all the cancers, pancreatic cancer causes the 4th most deaths. It's expected to cause the 2nd most deaths by the year 2030. That's telling me.
Is that right?
That's a doctor in the field saying you're not getting a handle on this. That it apparently it's going to get worse over the next decade.
Yeah.
More money, more research, more funding.
Yeah,
or just one of those diseases that.
Well, I think, again, like we talked about, because of the location of the pancreas and how you can't do an exam like a breast exam to discover this, it puts it at a really difficult place. I did, let me flip it on you a little bit.
Sure, go ahead.
I did see it's a statistic that showed from 2014 to 17 that the 5-year survival rate went from 6 to 9%. Now, it's small, but that's 3 people out of 100 that are here, and it's better. It's going in the right direction. So. Small bit of hope.
Seems like in the end, you just got to take care of ourselves.
That's all you can do.
The no smoking, the drinking, eat healthy,
do the
back on red meat.
Do the basics. Exactly. Some of this stuff. So you do what you can. You go to your doctor. As genetics become more available, and we identify genes that put people at higher risk, they're going to be kind of kept a closer eye on with various tests and so forth. But I would also counter the fear with, we can also get hit by a car or be in a car wreck or be hit by lightning. Some of these are are very rare things. I don't know that I would worry about it in the absence of symptoms. I mean, let's talk a little bit about pancreatic cancer symptoms. Pancreas, so abdominal pain, unintentional weight loss, that's such a big red flag. Please go in and get evaluated for that. Changes to your stool, to your bowel movements, kind of fatty, oily, greasy bowel movements are kind of are associated with it. And then jaundice, if your skin turns yellow, your eyes turn yellow. Those are kind of the classic pancreatic cancer symptoms. Absolutely go in soon to be evaluated for that.
Dr. Lary, always a pleasure. Thanks for coming on.
Yeah.
Appreciate your time. All right, gracias, Sal. We'll send it back to you.